Good afternoon. It's a pleasure to be here, and this meeting actually comes on the heels of big news for us here at Orasis. As some of you may have seen just a few days ago, actually, we have a PDUFA date. And for those of you involved in drug development, I'm sure you appreciate that's a non-trivial step in the path toward approval and commercialization. So it is really something to celebrate for the team here at Orasis, but also for our extended team in the eye care community. So I am really proud of the work that we've been doing together with partners across optometry, ophthalmology, and the community at large. And as some of you know, we've been working for years now to develop an optimized formulation for presbyopes. And by optimized, that means something that has to provide an opportunity to give them an alternative to their readers, but also something that is truly designed with those patients in mind. And so we've been talking to patients over that period of time, initially doing market research to understand what are the attributes that they would seek for us to prioritize in a product. But also we've followed that to understand better, to put a face on the presbyope. What are the things that are really important to them? What motivates them? What matters to them? And now, after speaking with over 2,000 of them, there's an idea that continues to emerge repeatedly, and that is that they're seeking a product that meets them where they are. Now, that means there's trade-offs they simply won't tolerate. It means they want a product that performs. And performance, of course, means efficacy, right? That goes without saying. But it's more than that. They want a product that provides them the flexibility to use when and how they want. And ultimately, it has to be safe. And so as we've evaluated this feedback, we realized that we needed to solve this problem across 3 dimensions, those dimensions being efficacy, safety, and comfort. And so as we pondered that universal dilemma of balance, the question emerged: how low can you go? And so we had actually considered props to encourage audience participation here in the afternoon, but we'll save that for another time. Because of course here what we're talking about is how low can you go in a concentration and still achieve your desired therapeutic effect without any compromises in the other areas you want to avoid, notably safety and tolerability. And so we're excited to say that CSF1 has really hit that mark. We'll share more about those data here with you momentarily, but our product is a 0.4% concentration of pilocarpine. And the concentration you'll see is very important as we continue to go through the presentation. The other thing is important to note is we're not the first company to tackle a problem like this on behalf of patients. Because you see, if 20 years ago, innovators had said, they'll think we're just another toxin, we wouldn't have Botox Cosmetic today. Or even more recently, if creative formulators had said, all brimonidine has baggage, we wouldn't have Lumify leading its category in setting new sales records. And so innovators have historically and repeatedly shown that products reimagined at lower concentrations in their therapeutic origins can be applied to new aesthetic indications successfully. And we'll show you how that is also the case with our product CSF1. So formulation matters. It is critically important. CSF1 is an optimized concentration of 0.4% pilocarpine, formulated at a near neutral pH. I think we just heard in a recent presentation the relevance of that pH. It's preservative-free.